Hey there, did you know that over the last 30 days, there's been over 18,000 Google searches for neurodevelopmental milestones? 30 days, 18,000 searches. Did you know that there's been over 8,000 searches for what is pediatric chiropractic? With the number one search being, can chiropractic help ADHD? I'm Dr. Monika Buerger. I've been in practice for over 33 years, building a successful family and pediatric-based wellness practice. Over the last decade, brain-based chiropractic has been exploding in the chiropractic profession. But do you know how to incorporate that brain-based neuro-focused practice into a family and pediatric-based practice? It's much different than an adult practice. How do you convert those Google searches into patients? How do you take those numbers and convert them into paying, staying, referring based patients? One of the things that I found is there's three biggest things missing. Is A, docs don't know how to communicate to parents on what they need to know in order to undergo chiropractic pediatric wellness-based, brain-based practice for their child. Next, you need to have the confidence, the certainty, and the skills in order to successfully manage these patients once they get into your office. If you don't have that, you're going to be another modality, another therapy that these kiddos don't thrive on, that they don't see the changes. And this is one thing we do not want for you as a practicing chiropractor to not have success stories, and for your community to say, chiropractic care doesn't work for my kiddos or doesn't work in these situations. Chiropractic care is hands down fundamentally a number one thing that we need to incorporate into a neurodevelopmental paradigm for every child on the planet. But the problem is you need to know what to do. You need to know what to look for. What are these developmental milestones? Do you have a keen eye? Do you have the ability to look at a kiddo, let's say in tummy time, and know all the different phases and stages of tummy time? Let's take tummy time. Why doesn't a child like tummy time? That's an important thing you need to know. Is there possibly digestive problems going on? Do they have a tongue tie? Do they have trouble with cervical extension? These are three major things that you need to rule out. You need to be able to identify where the problem is coming from. So let's take, they don't like cervical extension. For chiropractors, that's an important thing we need to know. One of the biggest things that's missed is oftentimes chiropractors tend to go just to the cervical spine because that's where they think the problem is with regards to cervical extension. But did you know that the cervical extensor muscles actually originate down in the middle thoracic spine? So you need to be able to lie that infant down and look, do they have vertebral subluxations down in that mid-thoracic spine? How to successfully clear those subluxations. What are the muscle patterns? Is muscles pulling on one side more than the other? That can be an indicator that there's a problem down in that mid-thoracic spine. So we need you to look at the cervicals, but make sure you look at that middle and the upper and the middle thoracic spine and clear those subluxations out. That can help you get that kiddo into cervical extension. You need to understand that by three months of age, that child should be coming up into about 90 degrees of cervical extension. Are they coming up to 90 degrees of cervical extension? If they're not, is that subluxation pattern in that middle thoracic spine? Then are they going through the different phases of tummy time? I call this the 4 phases: pull, push, fly, and rotate. Are they pulling their arms from above their head down? Are they pushing up on their arms? Then 5 or 6 months, are they bringing their arms to the side, like flying like a bird? And the biggest one you need to know, the biggest thing you need to understand is, are they laterally weight shifting or rotating through their core when they're in tummy time? That right there is the foundation for so much for the future of their core neurodevelopment. So again, kiddos on especially autism spectrum, the number one thing that's being looked at is their motor movement patterns in that first year of life, the first 2 years of life. So do they go through those 4 phases of tummy time? properly? Then, do they have enough rotational control around the core, around their axis, in order to sit up properly? And that's what another thing, that a diamond in the rough you want to look for is, are they sitting, but can they sit unassisted, and can they rotate through their axis? Can they rotate to reach to catch a toy, to hit mom and dad's nose, to catch some bubbles that are being blown at them? These are pivotal things you need to understand for optimal neurodevelopment, especially for the neurodevelopmental delayed child and the autistic child. So you need to be able to look at those activities with a keen eye and see, are they accomplishing those movement patterns successfully? Then you need to know, if they're not, what do we need to do about them? You need to have the skills of understanding that motor milestones are now the number one thing that are being looked at with regards to neurodevelopment, especially autism. 1 in 36 kiddos in the United States are said to have autism. And the number one thing that they're looking at in the early years of life is, what are their motor milestones looking like? And that motor milestones are now connected with language acquisition and social skills. And the number three things lacking with kiddos on the neurodevelopmental spectrum are motor skills, social engagement, and language skills. How does that tie into chiropractic? Can you take all the pieces together and tie that into chiropractic, into a neurologically focused chiropractic practice? Can you look at these kiddos and see what they're not able to do and what they are able to do? And can you relay that? Can you translate that successfully to parents, for them to understand why their kiddo needs your help? Do you want to build a milestone-based waiting list practice? No more marketing, just having pure, fun, neurologically focused chiropractic care in your office. You need to be able to master the nuts and bolts for these kiddos in order to be able to do that. If you don't have the foundational knowledge, the foundational know-how to master the nuts and bolts of a neurodevelopmental practice, then you need to look below at the link and join our Foundations of Neurodevelopment program. The Academy of Neurodevelopmental Practice is the most comprehensive approach you can use out there in order to master from A to Z neurodevelopmental milestones in your practice. So join me now, look below for the link, and we'll see you in our academy.